Hello, it's Joe Mullings with The Other Side. And today joining us from Huntington Beach is Scott Pantel. Scott is the CEO of LSI, and LSI is Life Science Intelligence. And I think that Scott's going to be able to drop some insight as to the market and what's happening on from his perspective. So, Scott, thanks for joining us today.
Thank you for having me, Joe.
You bet. So, Scott, first for our audience, that the few that might not understand what LSI does, because you're super active in the life science and MedTech industry, share with us a little bit about where you cover the industry and your perspective on things.
Okay, thank you, Joe. Yeah, so we are a MedTech market intelligence firm. So our business is to support the MedTech industry, whether it's manufacturers, investors, professional services companies, but our business is to support folks that are committed to MedTech by providing them with data and market forecasts, understanding of how markets are shifting, to support, really important decisions that they're making, whether it's acquiring a company, divesting a business, shifting amidst chaos, such as the chaos that we're going through now. So we're really an information company. We're not a conference company, although we hold an event on the West Coast each year to bring together, all of the folks in the ecosystem that we support. But we, in a nutshell, at a high level, we're a MedTech market intelligence company aiming to help our customers make the best strategic decisions that they can through data.
So how does your intelligence algorithm figure in this insane COVID situation we're in, and are there any analogs even close to it in yours and mine lifetime?
So in 2008 and 2009, with that financial crisis that we saw, I think there are some similarities. This is obviously a much bigger event with many more moving parts and directly impacting the healthcare industry. So in 2008, the financial crisis, we saw a lot of elective surgeries get pushed out. A lot of companies pause and get a little defensive, and then everything turned out okay. We rebounded, and we saw all those procedures come back. What we're seeing here is obviously much bigger, much more uncertainty. The impact to the total market is massive. We're seeing about a $75 billion decrease in the global medical devices and diagnostics market this year. This is based on some reforecasts that we've just completed. A lot of elective surgeries getting pushed out, over 10 million elective procedures just in the U.S. we see getting pushed out. But we do see it bouncing back. We see it coming back. And the question for us right now is, how quickly will it come back? And there's a lot of unknowns that we're all sorting through now. And then when it does come back, because the demand's going to be there, who's going to be ready?
Yeah.
And that's really interesting to watch. And I know that in your business, you see a lot of the different cultures of companies by the work that you're doing for them. And we see the same thing. We see some companies very much in protective mode, and others that are very much, I think, getting prepared for that inevitable demand that's around the corner.
Yeah, I was just on the phone with one of the large strategics and the leader of their ortho group, and they had literally a couple hours ago said, look, China's coming back online, Australia, New Zealand is coming back online. Another individual I was chatting about was they were trying to project out. In fact, they said down near UCLA, ortho is coming back online before interventional cardiology, because the margins are larger in ortho, because the hospitals need the money. The sacrifice that they made to treat all these corona COVID patients came at an expense, both obviously from an elective procedure, which is a large majority of the income to hospitals. So your thoughts there? What's the health of the health system going to be like as these patients come back in for their elective, or I've got to have a heart valve procedure, or a stroke, which I can't plan, which is an acute scenario? What does that mean?
I think those are some of the questions of the day, right? I mean, who's going to be ready? How long can we wait? If you look at just the U.S., we're doing we're looking at what states are coming back right now. What states are going to, New York and California are going to be looking at things much differently than South Dakota or other countries, or other states around the country. So I think those are the big questions. Which categories are going to come back most quickly? Which companies are going to be prepared to deploy resources there? Which healthcare systems are ready? We're right down the street from Hoag Hospital. It's a big hospital here in Orange County, and the hospitals, for the most part, it's empty. They're I think the system is ready to go. It's there's just so many moving parts, and I think those are going to be the magic questions. Whoever figures that out the quickest and the most accurately, I think is going to have the most success in the short term.
Yep. I've also had conversations with executives that are talking about finally more sensitivity and sensibility around alternative centers of care. For the most part, it's been a monolithic mindset on surgery and even elective surgeries in a hospital for the most part. Sure, your ASCs are carrying some of the load, but more at home, more virtual. Down here in Florida, there are strip malls being bought up right now to be converted to ASCs. Any forecasting in that area?
We're looking at it very carefully, and it's a big input, big and important input that's changing massively, as you've already pointed out. I think we've all been touched. My son has a doctor's appointment later this week. We're doing a Zoom with this physician. And this is a physician that's a brilliant guy, but not somebody you would imagine jumping on a Zoom meeting, if you know what I mean. So we're looking at that. It's going to be a big part of our inputs for the forecast for building. We see the shifts happening. All those companies, those emerging companies, the telehealth companies, and the ones that have sort of, been plugging away and, sharing the vision for so long, they're on the forefront right now, and they're in a great spot. And I think a lot of the legwork that they've been building, we're going to see coming to play really quickly. So we do see major shifts, massive shifts, and we're trying to quantify again how quickly is it going to roll out, how's it going to impact the market short term, long term, and that's another big piece of the market that we're looking at.
And so you've had a career in MedTech probably as long as I had. You were MedTech Insight, Windover, and then Life Sciences founder and CEO. When you and I think back, I've been at this business since 1990. When I think back, you can only think of the old Covidian days or the Kendall days or the J&J days and the Medtronic days and even Guidant. Moving forward, are the dominant companies for the very first time in our lifetime going to be non-MedTech companies when it comes to the delivery of healthcare? When you think about telepresence and you think about virtual, where MedTech has pretty much zero expertise in that area, so to speak?
I think absolutely. As recent as the last 2 years, we've seen, some of these non-healthcare players come into the market, and now it's right in our face. It's there. It's going to happen. I think the answer is absolutely yes. And the intriguing thing is going to be the partnerships that are already built. And there are some big ones that are out there. They've got a jump start on things, and it's going to be really interesting to see how the others react. That may be, they may be at they're in the red zone, but they're not at the goal line where some of these other companies are. So I think absolutely those non-traditional healthcare players that have been, circling the boat, they're coming now, and I think that's going to be one of the big changes that we see short term and for sure long term.
Yeah, and just even from a utility mindset, right? So I start thinking about delivery of healthcare. For the most part, healthcare moving forward in the foreseeable future is not going to be about the gadget or the snazzy response to a need, but really blocking and tackling, healthcare where cost, access, and outcomes are going to really be what we compare everything to. I see a Verizon coming in. I see an Amazon coming in. So delivery of information over a pipeline, Horizon. Delivery of, for the most part, commodities, which are about 55 to 60% of the industry, delivered via a virtual engagement with the clinician right there on the spot. Your meds and or low-level prescription is delivered to your house within 12 hours. Likely?
I think so. Again, a lot of the things that we've been watching from the sidelines and saying, is it coming? The Amazons, are we going to see, a healthcare hub in a Home Depot and a Walmart? Are those things coming? Yeah, absolutely. And this is going to be the thing that pushes us over the top and makes it all happen. So again, I think the companies that that have been working hard at this thing that felt so far away are positioned really nicely.
Yeah.
And the innovators, we work really closely with a lot of early stage companies. I know you do as well. I love it just because I'm intrigued, but they're the ones that are driving this thing. The innovation needs and the appetite for new technology in healthcare, as you know, is enormous, massive, and it's ongoing. And I think those innovators, we're really going to see the impact and the importance of those guys. So yes, I think you're spot on.
Yeah. Do you think that, and I'm glad that you're in the emerging tech startups like I am, so we don't necessarily have to be careful what we say about the legacy thinkers on the large strategic. I respect them madly, and they've got a business to run and profits to hit on a quarterly basis within itself doesn't chime into progress in MedTech. But do you think that the 60 and 70-year-old white guy at the top of the large strategics who probably has a hard time getting onto his or her Zoom account is really the person who should be setting strategy for MedTech moving forward in this virtual connected world?
I think those guys have a lot to offer, but I think they've got to have. I think we're going to see some winners come out of this, and are going to be the ones that are able to transfer that wisdom, that operational experience that they have to that newer generation, more technology-driven, that culture that we're seeing come through. So I think the answer is maybe in certain cases, and in other cases, I think we're going to see massive shifts.
Mm-hmm.
But I think there's a lot of wisdom, in that group. You and I have been around for a while, as you pointed out, and so we've seen these changes. You see the new group of folks come up through the ranks, and I do think this is again going to be another factor that pushes that forward a little more quickly than we anticipated.
Yeah, and again, I don't want to minimize the value that really the 30, 40-year career people have in the industry. I just get concerned when I think about the moving targets of how is market access going to change? What does reimbursement look like? What do GPOs look like moving forward? What's delivery of care look like in a virtual world or a more virtual world? And then what do clinical trials look like moving forward, and what kind of impact over the last 90 days and in the forward-looking maybe 12 to 24 months are going to have on the validity of data on clinical trials as well, when you've got this, subterranean virus running around and we don't quite know what impact it has on the human body, whether you were, asymptomatic or full-on blown COVID.
Yeah, no, I think it's really interesting to look at the cultures of companies, and sometimes there's a direct relationship to the age of the CEO. Let's face it. Mm-hmm. But it's really interesting to see that, and that's not always the case, but often it is. And I think it's really interesting to see the culture of the companies and the way that they're responding to what we're going through. Because as tragic of a situation as this is, and as serious as it is, it's really great to be working in an industry where you actually can have a positive impact on what's going on. Yeah. LSI is not creating a diagnostic tool, and we're not creating medical devices, but we're supporting the industry that is. And when you watch the reaction of some of these companies, there's a definite, if I generalize, there's a category of those that are on defense mode and pausing, and those that are full attack mode. They're ready to punch it in the end zone. They're not going to, sorry for the sports analogies, but I know I enjoy the ones that you make. But they're not going to settle for a field goal here, and they're really very much in attack mode. And I do think there's a correlation to the culture and the the structure of those companies and the youth of those companies. I really do, and I think it's gonna grow. It's in the magnifying glass now. Yeah. It's not changing.
Yeah, and it's interesting because you mentioned that, and look. Dave Pacitti is a young leader of Siemens Healthineers, and Dave is just, knowing what I know about what they're doing there is just absolutely attacking. Omar did a really nice job on his way out, and Jeff is doing a tremendous job in his response to what Medtronic is doing in regards to their approach to it. And while they don't have salespeople, actually in the hospitals, the amount of lifting that's going on with virtual training, virtual engagement with customers, those are really reflective. And then there are some others, I won't name them, are very, very slow and waiting to see what happens rather than drive initiatives. So that's a great point you brought up.
Yeah, and just to add to that, you know, again, we're looking at market demand, we're looking at data, and these markets are going to come back. Mm-hmm. The question is, you know, they're going to change. There's going to be some shift, but these are the times where we've seen over the years in very small, little, much smaller versions of this. How does the market share shake out after this? Because I think those companies that are pausing and those others that, you know, that are really prepared, whether it's existing relationships or stuff they're working on today, right now, that market share is going to shift. And so there's going to be some changes and some movement. And those guys that were dominant market share leaders forever could get their clocks clean. A lot is going to be determined by how they're structured right now and what they're doing right now. Yeah. So it's going to be an interesting time.
You had a great report you released out on April 7th. I read it and I put it aside, the impact of COVID-19 on global med device. And you called out high exposure, moderate exposure, and low exposure. And a really well done piece. If you haven't seen it, people check it out. It's on LSI's website. Have you, with the new information you have over the last 30 days, with what you knew then and what you knew now, any changes on the direction or forecasting there?
Not a lot of changes. We're working on a second scenario, which will include a more prolonged recovery. Our initial scenario, we're still feeling pretty confident about, but we are working on an extended situation. But again, the geographies are all over the place. It really depends on what you're looking at. You know, different situations in China versus the U.S. right now. And so have things changed in the last 30 days? Incrementally, we've seen some incremental changes, nothing major, but we are putting together, you know, a potential scenario which looks at a longer recovery. We think the recovery is going to be on schedule. We think things are going to come back in 2021, even in the fourth quarter of this year. But again, a lot of moving parts. And so we're doing what everybody else is doing. We've got, you know, scenario 1, scenario 2, and you know, be prepared to move quickly.
Mm-hmm. Is the market a zero-sum game, or do you see our market even expanding more with the full embracement of virtual and digital finally getting the catalyst it needed?
Great question. When we look at our 5-year forecast, when we look 5 years out right now versus where we looked at 5 years out, you know, 6 months ago, things are up incrementally. They are up a little bit, not massively, but I think that's a really good question, and it's something that needs to be looked at carefully. So I guess the answer is not sure, but think that there is a potential for there to be some, you know, overall growth.
Yeah. And is there any area in particular that you think was underclubbed before this crisis, and now as we come out this other side, and there's maybe for the first time, I think this week, there might be a slight horizon being declared. I'm not going to go on a limb yet. Is there a specific market that you think will have a big shakeup in it, and it might tip from one entity to another?
We're looking really closely at some of the cardiovascular markets, and we think that there could be some interesting things that happen there. Overall, I mean, the big winners are going to be the critical care companies, the infection control companies. Drug delivery is going to do really well. I think some of those will retract. Infection control is going to be, has a big bounce. It's more important than ever. So I think those are going to be some big winners. We look at orthopedics, and we know that they're hit really hard right now, but it's all going to come back. And who in the orthopedic space is going to be ready when it does come back? And so that's one that I think there could be some shakeup in is orthopedics. Cardiovascular as well, but there's some sort of inside info that we're we're working on right now.
Mm. Yeah,
So
I think ortho is, and it's funny. I was just ticking off my Zimmer, Stryker, J&J, and Medtronic competitors there, and there's a big toss up there, and I think it's going to have more to do for the first time. Look, I'll go out on the limb and say it out front. You know, the most questionable practices in MedTech have always been in ortho, as far as how you influence the clinician. I do believe that those who deliver a better pre and surgical and post experience and do it virtually more than anybody else is going to gain market share, and not sort of that half a point swing that we've been watching, you and I've been watching over the years.
right, I would agree with that.
Yeah, yeah. Anything I didn't cover while we chatted today that I should have, or you wanted to make sure that the audience hears?
You know, just that we've been through many versions of this. Never anything like this. We've never seen anything like it. You know, we're all going to look back on this. We're going to get through this. But these are the times where how we handle ourselves, treat our suppliers, treat our customers. I think it will have a lot to do with how it all sorts out long term for us individually. I'm just happy to be a part of what you're doing here, Joe. Really appreciate your content. Really, I think it's really important the way you pulled all the different entities in our ecosystem together. I love, you know, the MedTech's always been such a small world in my mind. And, you know, it's the relationships in the industry that are so important. And I really want to thank you for what you've done with this content and with this program to keep everybody dialed in together. We feel like there's a lot of hope out there. We had a big event that we did in February, right before, you know, things came crashing down. And there really was this theme of we're all in this together at that event. And that was prior to this being an issue. And now more than ever, I mean, we were in it together then, but really we're all in this together now. And so again, we're just LSI and my whole staff, we're thankful that while again, we're not making the technologies that touch a patient, we're hopefully supporting in a positive way those that are. We tip our hat to all the folks on the front lines, the folks in the ecosystem that are supporting the industry. And so I don't know if I've answered your question, but I guess we're just full of gratitude over here that we get to be in an industry that can have an impact. And we're equally, you know, cautious and concerned about what's going on. We're also optimistic and hopeful that we're going to come out of this thing on the other side just fine. And we're happy to be a part of that. So thank you for doing this.
Yeah, no, my pleasure. And well put. Look, the cool thing about this industry is certainly we can't be thankful enough to those who have been on that front end, and can't also underestimate the PTSD that they're going to have on the other side of this, right? But one of the cool things about MedTech in my 3 decades is whether your hand is actually buried in somebody's, you know, stomach, literally as a physician, or you're on the back end of research like you are, or headhunting like I am, and media like I am, the mutual respect across all those lines is not tiered. It's really interesting, as you know, when you walk around shows and I walk around shows, you could be Marty Leone or you could be Scott Pantel, and nobody's held at a higher or lower grade. And that's what's really cool about this, because everybody's in this for the patient.
Yep.
Yeah. Well, listen, I appreciate it. Kudos to you out in Huntington Beach, and I appreciate your time today.
All right, Joe. Thank you very much.
Thanks,
have a great
man.
day.
You bet. This has been Joe Mullings with The Other Side.